emergency, as we know, that requires a local response. Nevada County has successfully sheltered in place and kept our infection rate low. We're poised to be one of the first counties to move through phase 2. That's amazing news. Let's not lose our place in time. Dr. Cutler rescinded the local stay-at-home order this morning, but the state's modified order is still in place. I want to make that clear. The state's stay-at-home order is currently still in place. The local order prohibiting short-term rentals will stay in place until further notice, as non-essential travel between counties is still prohibited under the state's modified stay-at-home order. We want to help our residents understand and comply with the state laws. Nevada County is doing everything we can to be ready to submit our attestation to readiness as soon as possible. And this is the great news today. We believe we will be one of the first, if not the first county, to achieve this milestone with the California Department of Public Health, as we have a CDPH review meeting at 10 a.m. on Monday already. This is the first step in this process. This will help us move quickly through phase 2, beyond the first part of it. We want to be back in business as soon as possible with a sustainable plan. Premature opening can lead to bigger economic losses, as an outbreak will put the entire county back at home and threaten the lives of friends and neighbors. This is a razor-thin margin. Just 10 new positive cases or 1 death in a 14-day period, and we're significantly set back. Because of the work we've done, we are in the final stretch, and I want to thank the county staff who've done an amazing job working around the clock, and I want to thank our community for complying with these local orders, which has helped us keep this rate low. Let's not lose the good work. We have resources to help you to be ready to open the moment it is safe to do so, regardless of what phase your business in. We're figuring this out together. And as chair of the board, I am prepared to convene an emergency meeting if needed in order to move forward as quickly as we can as soon as the state allows it. We know our local businesses are suffering unimaginable losses and that seasoned professionals are facing challenges they never could have anticipated. We're in a very new place. You are our friends, family, and neighbors. Meeting these challenges requires humility, creativity, and commitment, and a bit of a comfort level with uncertainty. There are now multiple programs for disaster relief business loans, unemployment supplements, and a local relief fund that will go to the most direct needs. And if anyone needs help accessing those, please let us know. We're here to help with that. We understand this is not enough, and we will continue to work together to find and harness every resource for Nevada County as quickly as possible. I'm very excited to be part of announcing this great news today, and now I'm going to hand it over to Molly Dick.
Good afternoon, everyone. I'm Molly Dick, the Assistant County Executive Officer with Nevada County, and I've had the pleasure to chair a Recovery Advisory Committee over the last several weeks, which has been working hard to get resources in place to help our local businesses be ready as soon as Stage 2 is activated. So today was the first day that Stage 2 began. It began with just curbside retail businesses being allowed to operate in that limited fashion. That's part of the governor's statewide Stage 2 plan. As Supervisor Hall mentioned, we are working very hard around the clock to be ready to move through Stage 2 as quickly as possible. What that means is that some additional businesses will be able to open. Those businesses include things like destination retail, personal services such as car washes, pet grooming, tanning facilities, and landscape gardening, office-based businesses where telework isn't possible, and also dine-in restaurants with some limited capacity. It does not include bars, it does not include gyms, it does not include other fitness facilities, it does not include hair salons or other personal care type services. The state's website just released a more comprehensive list, and we would recommend people go to the governor's website for the COVID roadmap to recovery to get additional details on which businesses are included in stage 2. So I want to share with you a bit about the work that's been done to prepare to move forward. As Supervisor Hall mentioned, we are working hard on this attestation. We just learned late yesterday what all the components of the attestation are, and also we're just given the form that's required in order to file that attestation. So immediately, staff started working on dividing and conquering that work. Reaching out to our local skilled nursing facilities, our hospitals, and our homeless service providers, which also have components of readiness that we must meet in order to attest that the entire county is ready to open. We've also reached out to the hospitals to let them know we'll need a letter of support from them, in addition to the letter of support from the Board of Supervisors, which Supervisor Hall mentioned the board will be ready to convene an emergency meeting as soon as we're ready to submit and create that board letter. The Recovery Advisory Committee, as I mentioned, has been meeting to prepare businesses, and I want to share a bit about what that group has been doing. So we've been looking at the state guidance, at OSHA guidance, at industry guidance to identify what are the best practices that businesses can start to implement in order to be ready to open as soon as we can attest and be ready to open the rest of the stage 2 businesses. We'll be providing those resources later today through the mynevadacounty.com/coronavirus website, as well as providing links to the helpful resources that the state just put up yesterday and the other industry resources that are available. We're also creating some signage for businesses and some forms that they can use to create the plans and the documents that they'll need in order to be compliant with the state's guidance for opening the rest of stage 2. So we're looking forward to assisting those businesses. We think these resources are going to allow them to use this time while the county is working as hard as we can to get this attestation filed so that they can get their businesses ready as well, so that as soon as we're ready to go, they're ready to open. So thank you to all of the committee members who have been helping create those guidelines, and we look forward to assisting those businesses implement them. So next I'm going to turn it over to Robin Davies.
Thanks, Molly. I really appreciate the opportunity to be here with everyone today. And while I represent the Greater Grass Valley Chamber of Commerce, I am here on behalf of the Nevada City Chamber and the Grass Valley Downtown Association. Our 3 organizations have worked hand in glove together through this crisis to support our community, both our citizens and our small businesses, large and small. And it's been a pleasure, and that's one of the benefits of this crisis, if there is any benefit, is it has really united our organizations. And I have to say, from our perspective, we are very thankful to the County of Nevada for what they've done to keep us safe. We are secure. Our numbers are great. We are close to that happy day. The news today is not just good news, it is great news. It's fabulous news for our business community that has been waiting daily for news from our community, our county. Where are we as we watch other counties open up? It's been a little bit difficult, but the great news is our county is doing this correctly. There will be no backlash, there will be no ramifications. We do not want to do anything incorrectly. We want to step correctly toward reopening and reinvigoration and vitality. So I want to thank my colleagues who have done a magnificent job today with stage 2 being launched and the curbside pickup and delivery for retail. We did a walk around in downtown Grass Valley. I know Nevada City was doing the same. We had informational packets on protocol of opening our businesses and signs telling everyone what services were available at each business, and a bottle of hand sanitizer, which is absolutely essential. And it was met with great, great gratitude. Our businesses are very anxious to reopen. They're looking forward to getting back to welcoming you through their doors. And I know that it will be done correctly and in the very near future.
Hi, I'm Supervisor Dan Miller from District 3, and I want to expand a little bit on what Robin said, because one of the things that we're going to need to do is we're going to need to get this information out to the business community, and that's where the chambers play a vital role along with downtown associations both in eastern and western Nevada County. So as this information becomes available to us, we're going to get that information out to the chambers, who will then get it out to its hundreds of members. That's the quickest and easiest way for us to do that, to share that information. Over the past few weeks, we've been receiving a lot of emails, a lot of frustration, a lot of fear, a lot of confusion, a lot of anger. And hopefully what we're seeing is we're just not seeing the light at the end of the tunnel. I believe Nevada County's ready to step out of that tunnel where other counties aren't prepared. This news today, as far as the phone call on Monday with the California Public Health Department, that's huge. And what it says that our county staff really worked overtime to get this done. And I think that what we're going to be seeing a lot of that confusion, a lot of that anger fade away as these destination retail businesses are allowed to open. And certainly there's going to be guidelines, and I think most reasonable retail understands what those guidelines are going to be. And our economy is going to come back, our economy is going to be strong. And as we move forward, as we get through this second phase of stage 2, and stage 1 is basically a statewide order. Stage 2, actually, we identify businesses that are going to be able to open. Besides shoe stores, we're going to have destination businesses such as furniture stores. And, people who really have contributed to our economy for such a long time. So as far as being a member of the board and being involved in this and listening to all this information that's been coming down day by day, I just got to compliment, the business community. We have to compliment our county staff, and we have to compliment the public as a whole, because this has not been easy. Things from the state have been moving very quickly. There's been a lot of confusion of what they're going to do. And that confusion's really translated down to the different counties, and counties are moving faster than perhaps maybe they should, but at the same time, you have to understand and believe that what's going to happen is going to happen when the state finally lifts the orders and gives us the freedom to open up those economies again. So Monday, we're going to go to that attestation call. The county's going to be in conversations. Our plan will be complete. And that's something that most counties can't say. Our plan will be complete, and we're going to be moving forward. So stay tuned, stay with us, be patient. And I know patience sometimes is a virtue. It hasn't been something that I've been good at. But at the same time, I'm asking our businesses, our retail, just to be a little more patient. So thank you.
All right, at this point, we're going to go ahead and start doing questions and answers. So I'm going to go ahead and
Are you going to moderate this?
yes,
Okay.
ask the first one. So this actually will be for one of our Health and Human Services agency officials. Can you tell us a little bit about current recommendations on masking, and if there's any consideration of a face mask directive while reopening?
Hi, I'm Jill Blake, the Public Health Director. Right now, our health officer has a recommendation in place, but it's not a directive. There's rationale behind that. There's evidence showing that it can be helpful to wear a mask if you're trying to prevent the spread of disease from yourself, if you have a covering over your face that might capture droplets. But there's not a lot of evidence about you wearing it to protect yourself from other folks. So we like to recommend, we like to give those directives when we have direct evidence-based practices to recommend. This one is still sort of on the fence, but there is a recommendation to do it because we don't see that it's going to cause any negative benefits. But I will tell you that it's not easy for everyone to wear a mask. There are some people who have asthma, other conditions, claustrophobia, people for whom it's really difficult to wear masks. Once it's on, people tend to fidget, they tend to touch it, they tend to touch their face, and in doing so, they could be contaminating that mask. So we want people to wear them when they can wear them safely. We want to wear them when they're in public, when they're within that 6-foot distance or less than 6-foot distance between others, if they can do so safely. So at this point, the recommendation stands as is. Whether or not there'll be a directive, I can't say that we will have one, but I wouldn't rule it out entirely. We'll see what the evidence shows and where our health officer falls.
Thank you, Jill. This next question will be either for one of our chair or vice chair supervisors or our CEO. Can we briefly touch on the implications of the 2021 fiscal budget in light of coronavirus?
So thank you. So the board has done a preliminary review of our budget. This was prepared before the coronavirus hit. What we're going to do now is going to go back and look at each of our departments individually and as a group to make sure that anything we do isn't simply going to be a reaction. Right now, we're in good standing. We are not looking at any major changes, potentially 5 to 10% cut, and whether it's depending on the impact. But we're not going to be laying anybody off at this point, and we don't see any services, critical services being cut.
Thank you, Chair Hurl. Right now, I'm going to open it up to media questions who are here with us for our credentialed media. I can come bring the mic closer to you if you'd like to ask one.
In regards to the attestation meeting on Monday, what numbers do you need to have for that in order to get a positive response? And at that meeting, then, will you be told yes or no on moving forward?
So again, Jill Blake from the Public Health Department. There's criteria that's set by the state. There aren't necessarily numbers that we have to meet. We just have to attest that we meet this readiness criteria. The call, so we will have our attestation plan completed before that call. On that call, we'll review that plan, review the criteria to make sure we have a shared understanding of what those criteria are, and then we'll get some feedback from the state. At that point, we will have an opportunity to sort of step back and make corrections if we need to, or consider them in a slightly different way if we need to. And from there, it will just be a matter of getting others to sign on with their letters of support before we can move forward. What we don't know is that once we do submit everything, we don't know if there's a lag time between the time that we submit our attestation documentation and the time where we sort of get that green light from the state. I imagine it will be very quickly, as there is a desire for those communities who are prepared to open to be able to reopen.
Jill, I'm going to ask you to stay there. We have another one for you. What metrics will be used to determine if the county needs to scale back?
So those are still in development. I wouldn't want to commit to them just now. We are working regionally with other health departments, other health officers to see if we can come up with consistent criteria for what it might look like to scale back. But as you might imagine, it's going to include an increase in the incidence of disease, is going to include whether or not how our healthcare system is doing, if our hospitals are getting overwhelmed. We'll certainly try to take that action before those things occur, and those defined metrics will be available next week.
The next question will be for one of our Board of Supervisors or County Executive Office staff. How will we know when an attestation needs to come to a special meeting, or will it happen at the Tuesday regular meeting of the Board of Supervisors?
So what we're waiting for is for the go-ahead from the state, and then we have to have this letter signed by the hospitals and by the Board of Supervisors. So if it happens right before our Tuesday meeting, we'll do it at our Tuesday meeting. If we get an earlier indication, if we hear something before then, we can convene a meeting within the legal requirement of time, which we will do whatever day of the week it is.
Thank you, Chair Hall. This question will be for Molly Dick, our Assistant County Executive Officer. What were the recommendations that came out of the reopening committee today?
Well, I can't go through the entire list today. There's about 3 pages in different categories of recommendations, but they really focus on 3 areas. The first area is your facility. What are some changes, physical changes to your facility that you could make that would help help social distancing? So it might be if you work in an office setting, are your workstations 6 feet apart? Can people move through their offices? Can they do their jobs and maintain social distancing? Things like that. The next area is really around employee management and keeping employees safe. So it's a matter of training. It's a matter of making sure your employees know what their responsibilities are, that you have a protocol where employees are checking in with their supervisor when they arrive to work and make sure that people are feeling well, or you're checking for symptoms, those types of things. And then the third area really is around customer protections as well. So what measures can you take to educate your customers, to protect your customers? That could be things like online transactions. It could be somehow no contact transactions, a variety of things. And so we worked through many different types of ways that businesses can make those measures in their businesses based on their facilities and then also the people.
Thank you, Molly. This one will be for likely one of our Health and Human Services staff. It's a question coming in on our Facebook feed. What is being offered for our children's summer activities, pools, lakes, rivers? These kids have been cooped up for a long time and summer is about to start.
So one of the phase 2 stage B items that can be considered for reopening is schools. It doesn't sound like our schools and schools across the state. The governor mentioned a potential early reopening, and that's been complicated by a number of factors, but it looks like school's going to start at the normal time. Summer camps currently are not recommended to be reopened, nor are things like pools. There are certainly outdoor recreation in small family groups is allowed at this point, and so people are allowed to get out within the county and exercise, and we have a variety of guidance on our website in terms of what can be done and what the safe practices are to do that. But certainly people can go out and recreate, but it's unlikely that things like summer camps and things that encourage congregation are going to be back to normal in the near term.
Great, thank you, Ryan. This next one will likely be for our Public Health and Human Services Agency as well. Any ideas about when second homeowners will be able to shelter in place at their second homes?
So currently there are some second homeowners sheltering in place in their home. Stage 2 does not allow for travel. The idea is that we're opening our communities for our community members. It's not deemed safe at this point to travel across county boundaries, so tourism is not part of Stage 2. So we're asking people to honor that. We're asking people not to travel across county borders, not to switch locations at this point. The short-term rental order will likely remain in place throughout Stage 2, and check our website for regular updates. If we do make a change, it will be posted there.
All right, thank you, Jill. And I believe we actually have one more for you if you want to stay up here. All right, so can you please clarify just what exactly is allowable under this early stage of Stage 2 today? Are customers allowed into retail spaces, or are we still only at curbside?
That's an easy answer. It's only curbside. Curbside for now. Other things can open up. Things will open up after we attest.
Great, thank you.
Thanks.
I'd like to offer once again if there's any final media questions before we wrap up.
Elias Funes from the Union. We've got a question from one of our live viewers. Is general dentistry in the current reopening phase allowed?
So that again is dictated by the state, and I believe that an order came out yesterday allowing for preventive dentistry to occur. We can double check the CDPH website, but I believe that as of yesterday, preventive dentistry was allowed.
Another one for you, Jill, and this will be the final one before we wrap up. Can you touch a little bit on the county's process of antibody and contact tracing that public health has been doing, and when exactly that started along the coronavirus pandemic?
Contact tracing is something that our communicable disease staff does all the time, unbeknownst to most people. So if there is somebody who has a contagious or communicable disease, if they have been exposed to others in a way that indicates that they might be able to contract that disease, we do those contact tracings. We talk to that person who's ill with a lab-confirmed diagnosis. We reach out to those person's close contacts, and we monitor them. We have conversations with them, and we ask them to quarantine until the period ends where most likely symptoms would occur. If somebody does get sick, then we're asking them to isolate and remain in isolation until they're better. In terms of antibody tests, we're not engaging in antibody tests right now. We're just doing the tests that are used for diagnosis. I think the last time I checked, the FDA had only approved 2 antibody tests, and they're not available on the open market at this point. And also there's some question about their validity and accuracy. We are certainly most interested in being able to engage in that serology testing or the antibody testing, but we simply don't have the means to do so yet.
Great, thank you. It sounds like we have one last question.
Can we get an update on how many people have been tested through the site that just opened at the Veterans Building?
Oh, I wish I had better numbers for you today. I think it was around 60 on Monday. I think it was 79, or sorry, Tuesday, I think 79 yesterday. And today, the last time I checked, there had been 25. I think I missed Wednesday in there somewhere, but really good numbers and increasing over time. And really, with very little notification to the community, we found out about that late as well. So we're quite pleased with the turnout so far.
Okay, lots of appointments available.
Yes.
And to reiterate for our listeners online, the question was how many tests we are doing at our Grass Valley testing site that was lifted up this week. Looks like we have one other question.
I just have a quick question, probably for Molly. Once you get the green light, how fast will the businesses in stage 2 be able to open? And will those businesses have the information they need to quickly reopen? Will they have done, their planning?
Yeah, that's a great question. We will be releasing initial guidance today. There's already guidance out on the California Department, the roadmap website. It's not the California Department of Public Health. It's on the governor's website. So certainly businesses, I think, are already in that process of looking at what they may need to do and modifications. So as soon as we have the attestation approved or we have that green light, there's no additional delay. Really, it's a matter of if that business has done their due diligence and they're ready. We will have county staff available to assist businesses who have questions or if they want someone to come and look at their site and get advice about what they should do. We certainly will be doing that, just as we've been doing with the essential services that are currently open. We've had staff visit the grocery stores and the hardware stores and help those businesses put in place the best practices to keep everyone safe.
Will those businesses have to get the okay from the county that their plan is acceptable?
There is not a submission or review of those plans at any level at this point. It's all attestation, or the business needs to be ready, but we aren't approving or reviewing those plans.
Thank you.
All right, with that, I think we'll wrap up our questions. Thank you all so much for being here and bringing your questions today. And thank you to all our residents who were able to tune in online as well.